So I had back pain on my left side anytime that I would sit for a long period of time. And what I want to do in this video is share with you how I got rid of it. So very recently was at an event down in Disney. I was teaching for 3 days and I was standing a lot, probably shifting my weight, but I was on my feet for about 17 hours a day and 3 days in a row. And then my family joined me and we ended up going through the parks for a couple of days. And I noticed on the plane ride home, I had a ton of lower back pain right here on the left side. And it was about a 7 out of 10, so pretty severe. And what would bother me the most was any time that I would sit for any period of time, like 30 minutes or more. I had a lot of trouble like crossing my left leg over my right. So like if I was putting my socks on or my shoes on, something like that, to bring up my left leg was bothering me a lot. I had a lot of tightness there, especially in the front of my hip. And then anytime that I would change position, like if I was rolling over in bed, if I was getting in and out of a car, would really bother me. Or if I was sitting for a while and then I went to stand, I just noticed a lot of tightness. And the main movements that I had trouble with, other than day to day, were like anytime that I would bend back, and I can still feel it there a little bit. It's like a 1 out of 10 right now. Or if I would bend to my left like that, that didn't bother me right now, but it did in the past. Those types of movements would bother me as well. So what I'm going to do here for you first is show you exactly what I did, and I'm going to show you how to do what I did for self-treatment when I was laying on my back, and then also in standing. So 2 different ways that you can treat this. And quick confession, I'm a physical therapist, and we treat this all the time, and we help people with this, and they do it naturally without unnecessary medications, injections, and surgery. So I want to just share with you exactly what I did. So to start, lay on your back, obviously comfortable position. Make sure you have plenty of open space. And then the first thing that I did was just grab my left leg like this, and then push down into my hands. So push the knee down into the hands. And a common misconception where people mess this up typically is they'll try to hug their knee into their chest. If you're having lower back pain on either side of your tailbone, you don't want to do that. I'll explain why here in a second, but you want to grab your leg, push your knee down into your hands, hold for 5 seconds. And this isn't like an all-out effort, like an Olympic effort. It's just like 50%, 25, 50% effort. 5-second hold, then relax. 5-second hold, and relax. And then we're going to do the same thing on the other side. So right leg, push down. So I'm trying to do this with my leg, but stopping it with my hands. 5-second hold, and then one final time here. So 5 seconds, 3 times. Great. Second exercise I would do is a little bit trickier, but what you're going to do is lift both legs up in the air, and then you're going to hold one leg, you're going to pull up on it, and your leg's going to push down. And then the opposite, the other side, so in the left leg, I'm going to push my left leg down and resist, and my right leg, I'm going to do the opposite. So I'm going to try to bring my leg up towards me. So pretty much the same as you're scissoring as you walk. It's the same idea, but you're using your hands to resist. Same idea, hold for a couple seconds and switch. 3 times on each side. Doesn't have to be too dramatic or, again, too much effort. Then finally, what you're going to do, and this is the important part, is we want to reset the front of the pelvis. Again, I'm going to explain more in depth exactly what we're doing here. But you can make a fist, or some people clench their hands like this, but I typically just make a fist. Place the fist between your knees, and then just squeeze together. And you might get a little click in the front of your hip, or it's actually in the front of your pelvis. So you just go like that, squeeze. You might feel a little click in your hip or the front of your pelvis, and then that's it. So pretty simple to do, right? Now, what I want to do for you next is show you a similar treatment that you can do in standing. So if you don't have, if you're watching this at work and you don't have the ability to lay on a mat table or an exercise mat on the floor. I'm going to show you another way that you can do this in standing. But first I want to explain why this works. So anytime that we see somebody with back pain, especially if they have herniated disc or degenerative disc arthritis in the lower back right above the tailbone, frequently what will happen is their pelvis isn't moving the way that they're supposed to. So the person will typically have pain sitting for long periods of time or changing positions, and they frequently have that hip tightness just like I had as well. So what happens is when we look at the pelvis, there's the tailbone, and then there's the right half of the pelvis, left half of the pelvis, right? And when we look at that, that can rotate. It's very minimal movement. It's not huge movement like your shoulder, right? But there are three joints there. The right, it's called SI, sacroiliac joint, left SI, and the left SI is exactly where I had my pain. And then in the front, you have a joint called the pubic symphysis. So when you're squeezing, if you feel a little click, it's not in either hip, but it's in the front of your pelvis, that's that pubic symphysis. And it's just a little bit south of your belly button. But anyhow, what happens is most commonly, the right half of the pelvis will rotate forward a little bit and it can get stuck. And that can create a lot of problems. And again, it'll create that pain in the SI joint, so on either side of the tailbone in the back, and then that can radiate around into the groin or the front of the hip, sometimes even down into the leg. So anytime that we see that, the way that we treat that naturally is we do these exercises exactly as I'm showing you here right now. So what I'm going to do here is stop the video, and I'm going to show you how to do this next in standing.
And finally, I want to show you how you can do very similar self-mobilization, self-treatment if you have that tailbone pain on either side, how to do this in standing. So if you're at work and you don't have a place where you can comfortably lay down on an exercise mat or exercise table, here's what you can do. So you're going to start with your feet about shoulder width apart. And this doesn't look like much, so I'm going to have to walk you through it or talk you through it. But what you're going to do first is it's called an isometric, so it's you're moving your muscles, you're tightening your muscles, but you're not really causing major movement. So you're going to push your right foot forward and your left foot back, and then you're going to do the opposite. So again, you're not going to see much movement here. Okay, so I work at a standing desk all day, and if I'm having back trouble, frequently I'll just do this once in the morning, and then maybe one time in the afternoon. So I'm not doing it all the time, but it's really quick and easy exercise. So basically 3-second hold, right foot forward, left foot back, and then the opposite, and then again 3 times on each side. And then when we're done, to replicate that, remember where we squeezed our knees together with the fist between our knees? You can do the same thing here, and what you're going to do is just there. Actually, I clicked out right away. I'm sure you couldn't hear that, but I could feel it right away. So what you want to do is don't bring your knees together, don't go knock-kneed. Keep your legs relatively straight. You don't have to lock them out, but just imagine bringing your feet together. And what that's going to do is you're going to tighten up the muscles on the inside of your leg and inside of your thigh. They're called adductors. And when you do that, it pulls down on the front of the pelvis and it resets that joint in the front called the pubic symphysis. So frequently, anytime that I do this, or if I'm working with a client in the clinic, what will happen is they'll get an immediate relief as soon as the pelvis begins moving normally again. So the tailbone pain will go away, they won't have trouble sitting, they'll be able to bring each leg up, they won't have that leg weakness or that hip tightness or anything like that. It'll go away pretty much immediately. So again, it's right foot forward, left foot back, and then we alternate 3 times, just like a 3 to 5 second hold, and then when we're done, we squeeze the feet together. Great. And if you want to go for the gold, you can do it twice. So anyhow, I hope this helps you. If you suffer with back pain while you're sitting, try both exercise. The exercise set where you're laying on your back. You can also try this out in standing, or if you know somebody that's suffering with back pain, especially while they're sitting, feel free to forward this and share it with them. Anyhow, this is Chad Madden. Thank you for watching, and I hope this helps you.